All right, welcome to episode 88 of Wednesday Night Live. Tonight we're going to be talking about natural solutions to pain management. And one of the reasons we're doing this is, I think that it's important for us to get a general understanding of what are some natural treatments for pain. Pain is unfortunately a part of life. And we all know that there is an epidemic of pain problems in the world today. We all know about the opioid crisis and that sort of thing. So essentially, I just wanted to cover very, very superficially natural solutions to pain, especially those that are plant-based. Okay. So tonight we're going to be covering natural solutions to pain, as I said. We'll start out talking about what is pain, why it's important. We'll move on to some of the pharmaceutical options. And then we'll really spend probably 10 to 15 minutes discussing inflammation-based solutions to pain. Because obviously not all pain is associated with inflammation. But tonight we're going to be focusing mostly on that. Then we'll talk a little bit about common alternative treatments, as well as herbs. And I think one of the things that I'd like to focus on, or at least remind you of, is that it is relatively important to keep an open mind when it comes to alternative treatments and to keep I would say, willingness or, maintain a willingness to actually try certain things. And we'll talk a little bit about that as we go through tonight's class. So let's start out with what is pain. Of course, we all know what pain is. One definition could be that it is a defense mechanism that signals a potential risk from mechanical, thermal, or chemical stimulation. One could also say that it's one of the most important public health problems that we have in the world today. And the International Association of the Study of Pain defines it as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. And what I wanted to focus on with this is that the emotional component of pain is incredibly important, not just from a subjective perspective, but also from a treatment perspective. Because what scientists have found, that is that some medicines that have anti-anxiety effects, herbs specifically I'm speaking of, have actually been shown in studies to actually improve pain just by taking off the emotional edge, so to speak, of the pain. So we'll talk a little bit about that as well. So stress reduction, one could say that building the resilience of your body and stress reduction and taking herbs that potentially can help with stress can also have a significant influence in terms of your perception of pain and, in fact, help improve pain as well. And we're all aware of pharmaceutical options. We're aware of the opioid crisis. And there's a book about the epidemic, how it happened. I can't remember the name of it, but it's about the family, the Sackler family, that sort of or behind the opioid crisis and all the things that sort of went wrong to precipitate that crisis. And it's a crisis that continues. There was an amazing interview on podcast Dr. Peter Attia, Attia, around a month ago. That really was around an hour and a half interview with the author of the book that sort of documented this entire thing. And for any of you who are interested in really looking into, maybe you don't have time to read the entire book, but are interested about how that opioid crisis developed, I would recommend going to Peter Attia, MD's podcast and listening to that interview. It was an excellent, excellent interview. NSAIDs, so, ibuprofen, Advil, etc., unfortunately, with chronic use, can cause stomach and kidney issues. Of course, we're all familiar with Tylenol, but many of you don't know that Tylenol is probably one of the most dangerous over-the-counter medications that there is. And in fact, there are many people who have commented that if it was released today, it probably would never be approved. And the reason is because the distinction, the line between what makes Tylenol safe and dangerous is very, very narrow. incredibly narrow, and Tylenol overdoses are incredibly common in emergency rooms around the country, and over time can lead to things like kidney damage. There's been some association with dementia and cancer of the kidneys. And one of the things that it's doing is it's depleting something called glutathione. And glutathione can be thought of as the master antioxidant of your body. And therefore, if it's depleted, say, in the liver, as where it is in the liver, then anything that's going to potentially be a toxin in the liver is going to be accentuated. So example would be, of course, alcohol. If your liver is depleted of this glutathione, unfortunately, you only need a little bit of alcohol to cause a significant amount of liver toxicity. But in addition to that fact, robbing your body of its primary antioxidant mechanism is something that is worrisome. And unfortunately, as I said, the line between what's safe and what's not with Tylenol is very, very narrow. And so if you can avoid Tylenol, every once in a while, of course, it's not gonna be a problem. But for people who are using Tylenol on a chronic basis, unfortunately, it comes with significant risk. Significantly more risk than you probably think, because it's an over-the-counter medication. But I would just remind you that it's not me that's saying this. Many experts have said that if it were to go through the FDA process now, it probably would never be approved as an over-the-counter medication. Other things like antidepressants can also be used for pain. Anticonvulsants also have pain associations because of what they're doing in the brain in terms of pain. In other words, they have an effect on seizures, but they also have other effects that can affect pain. And I guess the question is there inflammation or not? And if there's inflammation or not, then things like NSAIDs, of course, work on an anti-inflammatory basis. But not all pain is associated with inflammation. We've spoken about how just tissue damage, is going to be associated with pain because it's your body telling you that something wrong. In fact, there are people who have a very rare condition where there is no pain. They don't have any pain. And unfortunately, this is a very difficult life for these people because they can walk on the beach and they're not going to feel stepping on a shell. They end up often being maimed and with lots of injuries that they just can't feel, and therefore they continue to get worse. This is, of course, a very rare condition, but it highlights the fact that the human body does need the signal of pain to tell you that something is wrong. So tonight we're going to focus mostly on inflammation, pain that's moderated by inflammation, so things like arthritis as an example. And we're going to focus on a inflammation pathway that I'm going to try to make as easy as possible. So we're going to start here talking about what are called omega-6 fats. Now, we've spoken about omega-6 fatty acids in the past. These are things that are found in, they're essential fatty acids, so your body actually does need them, along with, say, omega-3 fats. Of course, many of you have heard that associated with things like fish and walnuts. And so we have these essential fatty acids, omega-3s, and omega-6s. The omega-6s are found in things like nuts and seeds, and then also, of course, anything derived from nuts and seeds, so things like oils as well. And the important thing to know is that a lot of, I would say, alternative, functional, integrative doctors often speak about omega-6 fats as inflammatory fats, but they really are not inflammatory. They are essential fatty acids. The problem happens is that omega-6 fats, you can think of them as walking down a road, and there are two exits to that road. One exit leads down this pathway that goes to something called arachidonic acid, and then prostaglandin and leukotrienes. Let me correct that spelling. But they can also walk down a path and go over to what's called prostaglandin E3. This is an anti-inflammatory compound. So unfortunately, in the American diet, North American diet, people are eating way too many omega-6 fatty acids. They're getting them in the form of seed oils like sunflower, safflower, soy. All these are very, very toxic oils that we've spoken about at length. Unfortunately, when we're overloading the system with these omega-6 fats, you're going to be creating a lot more of this arachidonic acid that then is going to lead into these other inflammatory components. And if you're eating it in the right ratio, along with some things that I'm going to be speaking about, you're going to be able to make sure that that omega-6 fat walks down and takes the right exit to be in an anti-inflammatory state. And there are plant-based compounds that are going to basically block an enzyme that will prevent it from walking off the road to the inflammatory path. And of course, I've put these. Let me move these down. Sorry about this. Okay, let me see if I can move this over here. All right. Well, essentially, what the first compounds we're going to be talking about tonight are sesamin or sesame lignans, which are found in sesame oil. Of course, it's also found in supplements. And this actually inhibits an enzyme called delta-5 desaturase that basically blocks the exit for the omega-6 fatty acid to go down that inflammatory path. That's what it's doing. It's blocking the exit. And therefore, it's going to likely push the omega-6 fatty acid to walk off to the anti-inflammatory road. And so sesame lignans are something that can be used. Additionally, we spoke about how arachidonic acid also leads to other, the omega-6 fatty acid is basically walked off this road down the inflammatory path. And once it's on the inflammatory path, it also, through other enzymes, goes and creates other inflammatory particles. These are called prostaglandin and leukotrienes. Now, these can be blocked as well, especially with herbal extracts of turmeric, ginger, rosemary, and green tea. Speaking of the COX-2 pathway. Now, COX-2 may sound familiar. And the reason is because there have been a lot of medicines that have been created to block this COX-2 pathway, like Celebrex, like Vioxx. Remember Vioxx that was taken off the market after it was discovered that Merck was hiding some of the side effects to COX-2. And it was reported, or it's been estimated, that something like 70,000 people died as a result of that medicine. It was really a good medicine in the sense that it worked very, very well for pain because it blocked this pathway and therefore was preventing this prostaglandin, this other chemical, to be formed. But unfortunately, it had an incredibly terrible side effect, and people were getting heart problems from this COX-2 inhibitor. Now, you might wonder then, well, what if I block it with these natural agents? Well, yeah, you're not going to get the same sort of problems. It's certainly not as complete a block. And turmeric, ginger, rosemary, green tea have also, of course, been shown over and over again to have incredible benefits in so many other ways. So you don't have to worry about the inhibition of COX-2. Aspirin, as an example, is, I believe, mostly a COX-1, but also has some COX-2. So you're starting to see how, as an example, aspirin is sort of blocking the production of these inflammatory particles. Now, it can take, so the omega-6 fatty acid's taken the inflammatory road, and then it's taken other roads with increased inflammation. And there's another enzyme called 5-lipoxyoxygenase, and that can be blocked by boswellia. Sorry for the spelling mistakes here. and turmeric as well also does that. And boswellia also has some anti-anxiety, anti-depression effects. So in addition to the anti-inflammation that you're getting with this blockage of this enzyme that's creating inflammation, you're also going to get some emotional benefits. And as we spoke about in the very beginning, it is incredibly important to focus on that as well. And you have to realize that the emotional experience associated with the pain is making the pain quite a bit worse, and quite a bit. It's making the entire experience to be significantly different. So if you can have something that's going to have an effect on your emotional state, or your stress level, or your anxiety level, and is going to also inhibit this inflammation, then that's a really good medication, or herb, I should say. Now, the Life Extension Foundation actually has a supplement that they've done studies to show that the combination of sesame lignans, boswellia, and turmeric actually has similar effect to acetaminophen, to Tylenol. And so this is something, as an example, that you could take or you could have in your medicine chest that is certainly much safer than. Now, it's not going to be as effective. It depends on what it's being used for, obviously. But what they were doing their test with just a general pain, it was as effective as the Tylenol. So there are ways that you can get these combination herbs and supplements that can be effective as well. So this gives you a general idea of the inflammatory pathway that we're talking about. So let's talk a little bit about common alternative treatments. And again, I think I really would like for you to focus on the fact that many of you may have drawn conclusions to some of these things to the point where either you feel like they don't do anything, or you might feel that that's not something that I would try. We often have common thoughts about various different things when it comes to dealing with common integrative or alternative treatments. The first that I'd like to discuss is acupuncture. And a lot of people, again, have very strange opinions of acupuncture. And what I always tell people is that acupuncture has been around for thousands of years, and that it's not a static science, traditional Chinese medicine, that is. It has been an evolving science. Now, it's not studied exactly the same way as Western medicine, but it has continued to improve over these thousands of years. And it is something that is really worth trying. And I recommend that if you do try it, and there are, of course, people in every city that do acupuncture, that I would recommend that you see someone who is who has studied, to become a doctor of traditional Chinese medicine and not just an acupuncturist. The reason is because there is an incredible pharmacopoeia of traditional Chinese herbs that have really incredible benefits. And if you can find a local traditional Chinese medicine doctor, it really is worth it to investigate. I myself get acupuncture on a fairly regular basis, and especially when I travel. I find that it completely resets me, and you leave a session feeling very, very good, very relaxed, and I see someone who, of course, she studied in China and can give herbs. I'm all for it, in the sense that it's really something that you shouldn't just make again, a lot of you have made a conclusion already regarding acupuncture. And I would highly recommend that if you're dealing with really almost any sort of nuisance, especially pain-wise, that you go see an acupuncture, traditional Chinese medicine doctor. I can't recommend it enough. Next is massage. And massage on a regular basis can be incredibly profound for your overall health, and can also, obviously, it feels great, but it also puts your body into a much more relaxed state, which can have both that emotional effect, but also have an anti-inflammatory effect. There are so many benefits to massage that I truly believe, even though I don't get them a massage as regularly as I think that people should, I think that ultimately, when it comes to really taking care of your health, I don't think you can be fully optimized unless you are getting some form of therapeutic massage on a regular basis. I always recommend to my patients, especially those that are married, that couples learn to do couples massage. They learn simple techniques to massage each other, because obviously massage can be expensive. And also, of course, it's a bonding experience for couples to be able to learn common massage techniques. Unfortunately, when I mention that, I don't get a whole lot of buyers in that regard. Either the wife gives me a look, or the husband gives me a look, or something to that effect. But there are some incredible books out there on how to do couples massage. There's certainly all kinds of videos on YouTube that you can learn simple techniques, or there are probably online classes as well that you can learn. But when it comes, since we're talking about pain in general, common, just very simple massage can be incredibly effective. The next I'd like to mention is utilizing an herbalist. A lot of essential oils have really significant pain alleviation, things about them. And there are herbalists that are all over the United States, and there's a lot of different types of schools of herbalism, and many people don't know that there is a very deep herbalist history in America. There's an American herbalism schools, and I've certainly met people who have had really profound improvements in pain by seeking the consultation of a licensed herbalist who's really done an enormous amount of study. Again, all this is, I'm not trying to take business away from people who are pain specialists. Obviously, everyone who is dealing with chronic pain should be seeing a pain specialist, but pain specialists don't necessarily combine or know about how to pursue alternative or integrative pain treatments like I'm discussing. So there are books out there on American herbalism. Obviously, many cultures around the world have their own herbalism schools of thought, whether it's Chinese or Ayurvedic. But since we live in America, there is a shockingly, it was sort of shocking to me when I learned about it, shockingly deep history and cultivation of American herbalism as well. So there are some really great books out there. There's a doctor, her name is Dr. Lowdog, L-O-W and Dog, who is, she's an MD, but also specializes in herbalism and that sort of thing. She's written several books. I heard her speak at a health food conference many years ago. I was very impressed. She's a good resource for that as well. But of course, you can find someone who is in your local area. Meditation and prayer, obviously, these are things we've spoken about before. Things like Tai Chi, Qigong also can have profound effects as well. And again, these are all things that are going to be beneficial if done on a regular basis, and with the focus, with the proper focus. Biofeedback still around. It sort of became really popular in the 70s and 80s, and then sort of died out, but is coming back now because of the technology. There's some incredible new technology when it comes to biofeedback as well. And I would just say that, again, a lot of people who are probably listening to this, I'm the same way. I was the same way at some point, where you just get this you sort of have this general notion or idea of what these things are, and that I'm not the type of person to do that. And I would just like to say that, that you should consider just getting over that, because look, we're here for a short period of time on this earth, and there are so many profound histories and so much depth in so many different ways of treating the body, that and there's so little risk, when it comes to things like acupuncture and dealing with a licensed, well-educated herbalist, that I would just urge you to give it a go and give it a try, and see how it works out for you. Be an explorer. Next, we'll talk about some herbs, and then we'll call it a night. Now, when it comes to herbs, you always have to look at and see whether they're going to interfere with any medications that you may be on. So that's really important. Cloves, I've been studying a lot about cloves over the last couple months, periodically. It's come up so much over the last couple months that cloves can be an incredibly powerful addition both to your food, but also in extract form can also be helpful for pain. Of course, CBD and other derivatives that activate the endocannabinoid system are going to be helpful for pain. Obviously, marijuana has some pain relief benefits. CBD doesn't have the psychoactive effect, but as I spoke about in a class probably somewhere between episode 20 and 40 or so, I spoke about how to activate the endocannabinoid system without using cannabis. And this is just a brief review, but there are dietary cannabinoids and phytocannabinoids that can be broken down into what are called polyphenols, which we've spoken about before, terpenes, and this concept that combining them is going to create what's called an entourage effect, where you can get more than an additive effect. Now, polyphenols are found in things like coffee, tea, in the lignans. Remember, we spoke about lignans earlier because sesame also has lignans. And so they're also found in flax. Oddly enough, they're also found in kale. All pigmented fruits, and even flavanols or flavonoids like quercetin. And quercetin we're going to be speaking about quite a bit next week, because next week we're going to be talking about COVID-19 and what to do at home, if you test positive. And one of the things is quercetin, and we'll talk about why quercetin is beneficial in COVID-19 next week, along with a whole host of other things. So please do join me next week. Next is terpenes, and these found in the essential oils of plants. Things like lavender and citrus can help not only with pain, but also with anxiety and depression. And so these oils, which can be dropped, can be put in an infuser or used in the bath, can be incredibly helpful, not just for anxiety and depression, but also because they're activating this endocannabinoid, partly activating this endocannabinoid system like CBD, and therefore can help with pain as well. Things like oregano, cinnamon, black pepper also have what's called beta-carotene, which is actually is acknowledged to be pretty potent when it comes to activating the endocannabinoid system, but not through hemp, essentially. So here we have lots of different ways of activating this endocannabinoid system, whether it's, again, through aromatherapy or in the bath or as a supplement or in the diet. All of these things in combination are going to have an incredible amount of benefits, way beyond anxiety, pain, endocannabinoid, but also all of these things are going to have antioxidant effects as well as anti-cancer effects and a whole host of other things. So when you see these plant compounds having so many incredible benefits to them, you just think to yourself, well, yeah, I really need to include these in my diet the best way that I can. Okay. Devil's Claw has been also shown in studies to be very helpful for pain as well. And all these things need to be looked at. The NIH has an alternative and complementary medicine database where you can go to look at potential side effects and drug interactions. That would be very important if it's something that you want to do. Rhodiola has anti-inflammatory and anti-anxiety effects. And as I said from the very beginning, that if you can improve the emotional component of the pain, the perception of the pain also decreases. And there are a whole host of Ayurvedic and Chinese herbs that are going to have this benefit as well. And ultimately, it's great if you can get some guidance on that. And that's why it's another good reason to seek out, an Ayurvedic doctor in your area, or a traditional Chinese medicine doctor. It's not all going to be 100% home run when you try these sorts of things. Some of them you might go and you might think it might not be such a great experience. So there's an element of experimentation here that you need to go through. But I truly believe that sort of education and experimentation is important for optimizing your overall health, and certainly if you're dealing with pain is important. I would just caution you that, again, it's not always going to be a home run when you try some of these things, and you'll find certain things that resonate with you and don't resonate with you in terms of healing and therapy and individuals. A whole host of those things go into it. So just be patient if you're going to try that. Berberine has also been shown to have some anti-inflammatory effects and things that can help with pain. I'm mixed on berberine. It has some incredible metabolic effects, but also potentially can have some side effects both to the gut microbiome, as well as it might be interfering a little bit with muscle growth. There's a whole host of things that make berberine one of those supplements that, yes, can have some really great effects on metabolic syndrome and diabetes and that sort of thing, but ultimately is something that you need to be cautious with. So that covers what I wanted to cover tonight. It's a relatively short episode tonight, but wanted to introduce just these general concepts to you, giving you sort of a very, very superficial understanding of what natural solutions to pain there are, and understanding basically, at least from an inflammatory pathway perspective, what actually is going on and why maybe some pharmaceutical options, especially the ones that are over the counter, potentially it's worth looking into other options. And when I speak about that, I'm speaking directly to people who are using Advil on a regular basis or using Tylenol on a regular basis. Certainly, if you're using Tylenol on a regular basis, I've given you an option. You can go to the Life Extension Foundation and look for that pain medicine, the pain herbal medicine. It's called, let me see, I have it right here. It's called Fast Acting Relief. Again, I'm not associated with them in any way, but they're a very good organization. So that would be worth something to try. And then again, if you're taking Advil on a regular basis, like a lot of people are, especially if you're taking it for something like osteoarthritis, that would also be a good one to try. Certainly turmeric has been studied for things like osteoarthritis. And I'm recommending, of course, that if you're stuck on Tylenol and Advil or some of the other NSAIDs, naproxen or whatever the case may be, that you open your mind up a little bit to some other options, and perhaps getting help by seeking out some traditional healing modalities that have dealt with pain. I mean, pain has been with us from the very beginning, and some of these ancient healing modalities have certainly come up with solutions or things that can help. And so I wouldn't jump to Tylenol and Advil, but certainly if you're using them on a regular basis, it's definitely worth giving it a go. All right, so that's tonight's class. Next week, going to be discussing COVID-19 and what to do in terms of supplementation and home treatment. There have been a lot of controversial statements made, and unfortunately, there are a lot of people out there who don't know that there have actually been studies, many, many international studies that have been done internationally that have been approved by the country for treatment, early treatment. So basically, we're going to be talking about early treatment of COVID-19. I won't be talking about vaccines at all, not because I have anything against them necessarily, but the notion of early treatment, it pertains to you whether you got a vaccine or not, and what the science actually shows, and what does the preponderance of studies show regarding various agents that have been studied internationally. So I hope you'll be with me next week, and we'll go through some publications about some of these other agents, many of them being supplements, and understand why they work and how they work, and how they can be integrated, and what types of protocols have been put in place for COVID-19. So look forward to seeing you next week. I hope everyone stays well, and I wish everyone a very happy, healthy new year. And I look forward to continuing to see you every Wednesday night next week and all throughout 2022. Hope everyone stays well. Happy New Year. Bye-bye.
Recording stopped.